Hi, Assalamualaikum, and good morning to all my friends and to Dr. Puan Nuraiwa binti Rosman. Today, me, Muhammad Norman Izani bin Muhammad Noor, and my friend Wan Muhammad Afiq bin Wan Marzuki, we will discuss about the nervous system, its component, and some common disease that affect it. Okay, first of all, we talk about the introduction. This nervous system is the part of the body center, so it gives some coordinating signal between part of the body and is enabled to respond to stimuli. Okay, next we talk about the component of the nervous system. Component of the nervous system, it has two. First is CNS, second is PNS. CNS is central nervous system. It happens at the brain and the spinal cord. PNS, it includes autonomic and somatic system. Okay, next we will talk about the common nervous system disease. Okay, first we will talk about the Alzheimer. Alzheimer is a neurodegenerative condition. It causing a memory loss and cognitive impairment. Okay, such as example, like forgetting daily tasks. We give such example like this, like Maria. Maria is a retired teacher, so he always forget to turn off the stove after the cooking, and she often misplace her keys and cannot remember where she put them, and even after that he's searching for hours and it can find it. Okay, second is Parkinson disease. Parkinson disease is a progressive neurological disorder. It caused by the breakdown of dopamine and producing neuron in the brain substance nigra. It's leading to impaired movement control. Okay, which means is like Parkinson disease is a condition that when a certain cell in the brain, it causes a dopamine neuron stop working properly or die. This cell help control your body move smoothly. When this dopamine stop working, it become hard to control your body movement, which can cause symptoms like shaking, stiffness, and trouble walking. Okay, number three is a migraine. Migraine is a neurological condition characterized by intense and throbbing headache. Migraine symptom has three. First is aura, second is headache, and third is post-stroke phase. Migraine can be caused from stress and genetic. Migraine treatment can we do like acute treatment during attack. It also can be treatment with a lifestyle adjustment.
Migraine is far and away the most common debilitating primary headache disorder, and it comes with a constellation of things beyond the headache pain that impact them, that impact their activities of daily living, and affect their ability to do the things that they love most. We know that it's from changes in the body and the brain's chemistry, and we know that genetics accounts for about half of all migraines. And sometimes we think about the migraine as just the headache. One really goes well beyond that. Migraine is the type of headache that typically affects one side of the head and oftentimes are associated with nausea, vomiting, light sensitivity, sound sensitivity, smell sensitivity. Also in terms of what the pain feels like to someone. Is it sharp, stabbing, dull, aching, throbbing? They don't feel well or they don't feel like they're their usual selves for the days before their migraine attack. Sometimes they're present physically, but they're not fully there. Sometimes people feel washed out. They don't feel themselves after the headache pain has gone away. And sometimes also those same people would share that it took a while to speak up and have courage to talk about their migraine or their headache, in part because if they had in the past, it was sort of dismissed. It's just in your head. It's just a migraine. It's just a headache. When it's not, it's something that profoundly affects someone and profoundly affects their family. If people are taking over-the-counter medication to treat their pain multiple times a day or even on a daily basis, that tells me that there's something going on that we need to investigate further. And paradoxically, over time, if people are taking daily, multiple times daily, as needed pain medication, that could actually make the headache worse that they're treating. And sometimes they could develop a new type of headache on top of that. But also that typically tells me that someone would benefit from a preventive medication or some other preventive therapy. In the last almost decade, there's been dozens of new treatments that have come out for migraine and other types of headache disease. Some of these are in completely new families of medications. Some of these are new formulations of medications that have been around for quite some time. Some of these are not medications at all. There's some really good evidence for some vitamins and supplements that can work really well to help prevent migraines and to help to reduce the severity of migraine attacks when people get them. There's neuromodulation or devices. There's several of them on the market and there's more coming. They can be used for prevention, so use it every day or sometimes more than once a day. And there's some that you could use in the throes of a migraine attack as well. Talk to someone about it. Bring it up. Headache and headache pain is not just in your head. It is very real. And if you bring it up to a doctor and they're dismissive, find someone else to talk to you about it. Because there are people out there that want to understand your pain, want to understand it so we could help treat it. You don't have to suffer in silence.
Next, I will pass to my friend.
Now I continue to epilepsy disease. Epilepsy is a neurological disorder that affects the nervous system. Epilepsy is a condition caused by unexplained repeated seizures. Seizures occur when there are sudden and uncontrolled electrical disturbance in the brain, which can affect behavior, movement, or consciousness. It is important to note that epilepsy is not a single condition, but rather a group of disorders that cause chronic seizures. The frequency and severity of these seizures can vary from person to person. Some individuals rarely experience seizures, while others may experience them more frequently and with greater intensity. Epilepsy can affect people of all ages, from children to adults. Therefore, it is important that we understand more about epilepsy in order to provide appropriate support to those suffering from this disease. After that, I will continue with stroke. Stroke is a serious medical emergency that occurs when blood flow to part of the brain is interrupted, leading to death of brain cells due to lack of oxygen. This interruption can result in sudden loss of movement, sensation, speech, or cognitive ability. Stroke is a leading cause of disability and can be death in some cases. There are two main types of stroke. First, ischemic stroke, which is caused by a blockage in blood vessel. Second, hemorrhagic stroke, which occurs due to bleeding in the brain. Both types of stroke disrupt normal brain function and have a profound effect on the nervous system, affect the body's ability to perform basic function, It is important to recognize the sign of the stroke early and seek immediate medical attention. Finally, I will talk about amyotrophic lateral sclerosis, ALS, also known as Lou Gehrig disease, which is a progressive neurodegenerative disease. ALS primarily affects the motor neuron in the brain and spinal cord, which control voluntary muscles. These muscles are essential for actions such as walking, speaking, swallowing, and breathing. In ALS, motor neurons gradually degenerate and die, leading to muscle weakness by atrophy and eventually paralysis. As the disease progresses, it greatly affects a person's ability to perform basic daily function. Unfortunately, there is currently no cure for ALS and it remains one of the most challenging neurological conditions. In conclusion, the nervous system controls and coordinates all of the body functions, from basic process like breathing to complex function like memory and decision making. When disease affects the nervous system, it can significantly reduce quality of life, cause physical, mental, and emotional challenge. Studying and treat this disease is essential to understanding the brain and spinal cord, which are the center of our health. With continued research, patient advocacy, and advance in neuroscience, there is hope for better therapies, better management, and the potential for a cure. That's all. Thank you.